Taoiseach, the situation in our health service continues to disimprove, with, as you know, up to 1 million people on outpatient and inpatient waiting lists, with severe overcrowding in our emergency departments on a consistent basis. And indeed today we learn that over 6,000 people waiting for elderly care services can be waiting up to 2 years. And that's just a number of the issues. But all of that has been impacted, Taoiseach, by the chronic shortage and crisis in recruiting and retaining qualified consultants. There are about over 3,3176 approved positions, consultant posts, in our health service, but only actually 2,713 have been filled. So that's about 463 unfilled qualified consultant posts. Our emergency departments are without specialist qualified consultants on too regular a basis, and indeed in psychiatry there's a chronic shortage across the board throughout the country, and there are other examples as well. And so in effect the shortage of qualified consultants is impacting on the quality of care and the timeliness of care for many patients throughout the country. Now, there's general agreement that the cuts to new entry consultant salaries, particularly in October 2012, is the key factor in this chronic inability to recruit and attract consultants to the Irish Health Service. There was up to a 30% cut in October 2012, and that pay differential is a major inhibitor in terms of recruiting qualified consultants. So we have an unprecedented number of unfilled permanent posts as a result of that, and that clearly is directly undermining the quality and the provision of essential care to patients across the acute hospital service. Now, the Public Service Pay Commission have confirmed the difficulty in recruiting consultants. They have identified, everybody seems to have identified, the pay differential between newly recruited consultants post-2012 and their colleagues before that. The differential between them, it can be up to 57%, is the major factor here. And when you add to that the fact that we have 40% fewer consultants than the OECD average, you get to see the picture in terms of the impact on the hospital services themselves. So, for example, in the Dublin Midland Hospital Group, Taoiseach, there are 6,500 new patients waiting to see a consultant urologist. Now, St James's Hospital has advertised twice and have failed to recruit a consultant. In eye surgery in Cork, around 6,000 patients are awaiting outpatient reviews. In a recent survey by the IHCA of 300 appointed consultants recently appointed post-2012, 70% are seriously considering resigning from their public hospital posts unless the discrimination against them ends. So, Taoiseach, in short, do you accept that we have a very serious issue in recruiting qualified consultants to the health service? Do you accept that the post-2012 pay differential is a key factor? And do you accept that this is impacting on patient care, adding to waiting lists and undermining overall quality? Taoiseach. And what do you propose to do about it?
To respond, there's 3 minutes. Can I get 1 minute?
You might explain to me why you didn't answer the question. And I very specifically focused in on the issue around the recruitment and retention of qualified consultants. And I pointed out to you the fact that there is a crisis in recruiting consultants because of a pay differential, because of the huge discriminatory pay difference between those recruited after 2012 and those before 2012, and you choose not to answer the question at all. You did reference improvements in cardiology and heart disease, let's be clear, and cancer, sorry. The cardiovascular strategy of the late 90s and the cancer strategies and the centres of excellence are the bedrock, the foundation stone for the different quality of care in those two sectors, long before you arrived on the scene. I think it has to be said. But Taoiseach, also the Treatment Purchase Fund, I'm glad you've outlined the impact of the Treatment Purchase Fund. You opposed its inclusion in the Confidence and Supply 3 years ago. And also, you know, it took us a long time to convince you and your colleagues about the merits of the Treatment Purchase Fund, and I'm glad that in some areas that the numbers are coming down, and hopefully over the next year, because of the budget allocation, that will happen too. But Taoiseach, could I just say to you, the Public Service Pay Commission has acknowledged the difficulty. I've asked you, do you acknowledge the issue.
Once
in 2005, over half the posts advertised received 0 to 2 applications. That increased to 60% in 2016. Waterford, there are 40 approved consultant posts, 36 are in place, but 20 of these are filled on a non-permanent basis. And in Letterkenny, 12 out of 18 posts are on non-permanent. So you have to accept and acknowledge there's a real problem here in terms of recruiting and retaining consultants to our acute hospital service. And will you indicate to me what the government intends to do about that specific and very important issue that affects the quality of care of patients?
Time is a factor.